and other. You may have heard that Connecticut's a slow-growing state. I think Coral's slides speak to that a little bit. Generally speaking, with the 2020 census, we saw a fairly slow growth in Connecticut. It was one of the slower growing states, though it did grow a bit. That growth in the population was due to increases in the number of adults in the state. So basically, a lot of people who were children, teenagers, maybe 10 years ago are now young adults. And we saw that population increase, whereas the population of children actually declined significantly in Connecticut. And the trends in the Valley generally mirror what we see in the state as a whole. So as the population ages, the birth rate goes down. There are fewer children being born, and that's the main reason why there are just smaller child populations throughout the state and in the Valley. There were a few places in Connecticut that saw more rapid growth. Generally, those are in downtown areas, so where housing is more affordable to young families that have more children, and where the new housing built drew workers, from other states and from other areas. So generally, we saw growth in Stamford, Bridgeport, New Haven, and a bit in Waterbury. And then in a few pockets, like you'll see in Coral slides, downtown Shelton in the Valley is an example where, quite a few new housing units were built in Shelton. So the population in that neighborhood did increase more quickly than in most other areas. So that just gives you a quick overview. I'll turn over to Coral to go through the rest of the data.
Hi, I'm Coral Wonderly. Let me just share my screen. So as Mark mentioned, I'm going to be going over the 2020 census and changes between 2010 and 2020. To start out, we're looking at the total population and the child population and the total housing units between Connecticut and the Valley overall. And again, as Mark mentioned, Connecticut and the Valley have seen pretty slow growth. Both were less than 1%, with Connecticut at about 1% at a 0.9%, with the Valley only having a growth of 0.2%. And then with child population, we actually saw that decrease both within Connecticut and the Valley, Connecticut decreasing by almost 10% and the Valley decreasing by 13%. For both housing units within both Connecticut and the Valley, these actually had the same change. So they both grew by 2.8%. So still relatively low, but we can see with all of these trends that Connecticut and the Valley are fairly similar in how they're changing over time. So when we look, inside the Valley, where exactly did we see this population growth? And we can see that it is predominantly almost all within Shelton. So every other town within the Valley either saw pretty much no change or actually saw a decrease in population. We see that Derby actually decreased by -4%, but Shelton is the only town where we had a positive increase, where we had a 3% gain in population. And this is the same for housing. So the Valley's housing stock grew by roughly 1,600 units, but almost 2/3 of those units were only in Shelton, where it had 1,028 increase in housing units. And then just like Derby had the largest decrease in population, it also had the largest loss of housing units. So then when we focus on Shelton, where exactly did we see this housing and population increase? So it was actually only in 2 census tracts within Shelton. You can see both in the housing units and the population, they're the dark blue census tracts. So at the top, we see the downtown district that Mark had mentioned, and then we also have that lower darker blue area where there's a lot of new development. In both of these areas, that's where the majority of the growth for not only Shelton, but also for the Valley took place. And for Shelton, we actually see that most of the census tracts had very little growth of around 5%, and then one census tract also lost housing units and population. So then going back to looking at both Connecticut and the Valley and switching to race and ethnicity, we can see that between 2010 and 2020, both Connecticut and the Valley are becoming more diverse. We see the white population of Connecticut has decreased from 71% to 63%, Where in the Valley, although it's still not as diverse as Connecticut, the non-white populations are increasing at faster rates in the Valley than Connecticut. We had the white population decrease from 83% to 73% within the Valley. And then, as been for a few decades, the child population is continuing to be more racially and ethnically diverse than the population over 18. We can see in Connecticut that now the white population is only 50% of the population, and 50% of Connecticut's population is now individuals of color. Whereas in the Valley, it's still not as diverse as Connecticut as a whole. We have 57% of the population being white, and then the remaining 43% being individuals of color. And as we look further into the towns within the Valley, we see that in 2010, Ansonia was the most racially and ethnically diverse town, with only 68% of the population being white versus 83% for the entire Valley. And then the least diverse area or town within the Valley was Oxford, with 93% of the population being white. And then in 2020, we see that Ansonia is still the most racially and ethnically diverse town in the region, with 56% of the population being white. And Oxford is still the least diverse town in the region, but now with 89% of the population being white. Every single town within the region did become more racially and ethnically diverse, and they're all still within the same order. So no town, jumped in terms of becoming more racially or ethnically diverse versus different towns within the region. And also, along with the trend that we saw with Connecticut and the Valley as a whole, children are still more racially and ethnically diverse. We see Ansonia is actually now has the white population makes up less than 50%. Same with in Derby, makes up 34% in Ansonia and 38% in Derby. And we also see in Ansonia the largest population by share for individuals under 18 is actually the Latino population now. And that is what I have to present, so we can start taking questions.
So Coral, I have a couple of things that have, thank you for that. And I have a couple of things that have come up for me. When Shelton is only the one that's seeing the measurable growth, while the majority of the towns are mostly seeing, either kind of negative growth or nothing, right? It's been stagnant. Is this a trend that's happening throughout the state, or is it just happening here in the Valley? And maybe you and Mark could comment on what you're seeing, not only here, but elsewhere.
I think we would both agree that when we look at all of the regions, the majority of places where growth is taking place are going to be the larger towns or cities within the region. Specifically, if we looked at the Greater New Haven area, the only town within Greater New Haven that actually saw a sizable increase in population was New Haven itself, whereas a lot of the other towns also decreased in population, a lot like in the Valley. And then the same for housing units. There were only 2 towns within Greater New Haven itself being one of them that saw an increase in housing units, and it decreased in a lot of other places.
I would just add, usually the areas that are growing are the ones that are where the child population is growing or stable, because everywhere throughout the state, the number of adults is still increasing somewhat. Almost everywhere, but like Coral mentioned, the child population is smaller, there are fewer births, but there is a difference in some towns like Bridgeport, areas, especially where there are more younger families, you have more children, so that's driving the difference that you see in growth rates also.
We have a couple of questions in the chat, and I'm going to go at them right now. The first one is that Seymour and Oxford have developable, that is a mouthful, land. And is there any affordable housing being created in any of the Valley towns? And I was actually going to ask that about Shelton. Is any of that new housing stock being designated for affordable housing?
So I was looking at some of the apartment complex that were, because it looks like the majority of the housing unit growth was apartment complexes in both the downtown district and that other kind of newer development area. And the majority of them were I would say more of your like luxury apartments. Not to say that they couldn't have been LIHTC housing. They could have affordable units within them, but I'm not sure.
And there was also a question about there being a difference between Fairfield and New Haven counties. Is this something that again, you are seeing in differences in counties and differences in regions, or is it pretty much the same that the larger cities and towns are the ones that are experiencing the growth?
Yeah, I mean, it's generally true that that trend of larger cities and places where younger families are growing faster. However, Fairfield County as a whole is definitely growing more quickly than anywhere else in the state. Part of that is because Fairfield County has so many urban centers like Danbury, Stamford, Bridgeport, Norwalk. So it's partly just the composition of that. But I think there's also just more growth in the New York area than sort of the areas like towards Hartford and Eastern Connecticut, just because of the economy of New York is growing much more quickly than in terms of the number of jobs. There's a lot more in New York City, and there's a lot more growth in New York City than there is in most of New England.
And I was going to make the point with both of you that geographically, Shelton is the first or the last, whichever way you want to look at it, town in Fairfield County, right? So when you're coming up Route 8, this is the last one in Fairfield County. And to your point, Mark, I think it really does speak to that, right? Of having that benefit and yet being close enough to New York to make it a commuting type of thing.
Yeah, we think that has important implications for the Valley. New York City is really impressive. Like, I believe in the past 10 years, New York City added more housing units than the entire city of San Diego, for example. It is one of the fastest growing cities in total number in the country. And there are jobs that are associated with that. So there are going to be opportunities for people who live in Connecticut, especially close to New York City, like much of the Valley is accessible to that area. There'll be job opportunities in those denser parts of New York, and that has important ramifications for like our transportation system and sort of other things.
That actually leads me to a question that someone posted in the chat, and I was forwarded it. Are you going to be speaking about economic status and how it overlays with population statistics? Are you going to have that a little bit later on in your presentation, or can you talk to it now?
Yeah, so the census, the 2020 census results, we should mention, like, they've only released the population counts at this point. So it's just number of people. We have other data on economic changes in towns throughout the state. We didn't plan to cover that in the presentation today, but definitely in the Valley Index. I'm happy, if there's time, I'm happy to talk a little bit about it, because there are important differences in like what types of jobs people have, income levels. They do vary across the Valley. And I think Val's brought up this point before. Connecticut, we often think of as like, sometimes the 5 Connecticut's is used. So you have sort of wealthy towns and older manufacturing centers and city centers, and the Valley sort of has a mix of all of those types of communities in it. You have places that are developed after the 1980s where it's sort of higher income workers, and the Valley hasn't because there's not a lot of new housing being built. The Valley hasn't changed dramatically over the past 10 years in terms of the economic composition. There may be neighborhoods where there are more higher poverty rates, for example, or where incomes are going down, but that's kind of reflective of the trend nationwide, where jobs in retail and certain type of industries are not paying as well as they did like 10 or 20 years ago. So sort of see those trends at work in the Valley also.
And Mark, I'm going to ask one more, and actually this is both for both of you. I am lost about what does it mean when Derby has lost many units. I'm trying to wrap my head around what does losing many units look like. Are the houses physically going away? Are they just, what do you all have that for a term of qualification?
So that's defined by the census, and it's probably not going to be an answer that you're looking for. So basically the census has a rate that they calculate. That's their housing loss rate. And that will have to do with the age of the housing stock, the number of natural disasters that usually occur there, or the number of mobile homes in the area, that will all increase your rate of housing loss. And so they take that rate of housing loss and then they look at the old housing stocks, that would be your 2010 census, and they will multiply that rate. And that's how they get the estimated number of units that were lost, either by being demolished or being lost to a disaster like a fire. And so it's just an estimated number. And so then they take the new builds and they subtract the estimated loss, and that's how you get that.
All right, that I can kind of get that in my mind now. So that was helpful. Thank you very much for that. And I have one more thing before we move on to the next section, and that is one of the things that's bubbled up for me is that some areas in the valley are still becoming more notably diverse than others, right, compared to the previous census. And how have population changes in the valley shifted the demographics of our region?
So I think the majority of this change is most likely seen by the child populations that are aging up into being to the non-child populations, because for a while, child populations have been more diverse than the adult population. So as we see those under 18 age into the adult population will continue to become more diverse. And so I don't know if Mark wants to add any more onto that, but I would assume that's the main reason.
Yeah, that when you think about population change, you think about births and deaths. So, we have 30,000 something births in Connecticut. We probably have around 30,000 or fewer deaths. So if you think about, the immigration history, the migration history in Connecticut, 50 years ago, 80 years ago, it was mostly white population, European immigrants, and then now mostly migration from like the New York City area. It's more ethnically, racially diverse. So partly it's just population change is sort of a natural process in that sense, based on the history of our country and where migration takes place, and the valley is affected by those trends.
Thank you. And one of the last questions that I see in the Q&A is about economic disparities on the change in this population growth. And does population growth, where realized, does it is affecting people of the lower economic strata more or less the same? I mean, basically, when you are looking at this, is it growing in terms of disparities between income levels, or is it just all across the board, Mark?
Yeah, so there's not like a specific correlation between growth and changes in economic status. It kind of depends on a number of things, like the type of housing that's lost in some cases. And then, the industry-wide changes. So you could have towns where the population's growing and most people work in sort of like the finance or manufacturing, like higher wage industries, and the population would be growing and also the income levels would be growing. And then in other areas, if you could have the population growing at the same rate, but the types of jobs people hold are different, it could look different. Inequality is something that's just generally been rising everywhere due to wage differences and other factors. So that's sort of a constant in areas that aren't growing at all. Like in say parts of Michigan, there's sort of the same factors at play. You still have a lot of inequality. You don't necessarily have more inequality where the population is growing, or vice versa, but it does vary from neighborhood to neighborhood.
Thank you, and thank you both for all of this information. Mark, can you please turn our attention now on to the findings of the Wellbeing Survey and the equity reports, and then we'll have some additional conversation. Thank you.
Great. Yep, I just shared a few slides here. I'll go through these quickly, and these slides will be available after the presentation. So if you want to look at them in more detail, you'll have time. You can email Val or email us with questions. But we wanted to give an update on the 2021 Community Wellbeing Survey. The Community Wellbeing Survey is a large survey of randomly selected adults throughout the state, including many hundreds in the Valley region. And we've conducted it for several years now, so from 2012, 2015. So we can kind of see the trends over time. I'll talk about those trends in a minute. This specific survey wave that we fielded throughout 2021, we're actually just wrapping it up this week or next, was designed with input from about 300 advisory council members. So probably some of the folks on this call weighed in on what questions to add to the survey. This year, we added questions about demographics, food access, COVID recovery, incarceration, and a few other topics. So the data I'll be showing today is from our initial data release in 2021. If you want to watch the full presentation of that, it's on our YouTube channel, so you can see in more detail. That initial release, it was based on our summer interviews. Like I said, we're still doing interviews, so the full data will be available, early next year. And this survey is, like I mentioned, it's supported by about 80 of the public and private agencies throughout the state. It's very reliable information because of the way the survey is conducted, where you're contacting households randomly and then weighting the results so that the data is representative of the population in any given area. So it's a lot of similar methods to other like large government surveys. Some of the things we found are, continuing differences in basic needs during the pandemic. So you have non-white adults, low-income adults reporting much higher levels of food insecurity in the state. And then we talked a little bit earlier about the 5 Connecticut's idea. So the town types, whether you're in a wealthy town or sort of a city center or an old manufacturing hub, that the rates are very different across those areas. So in this case, we found, food insecurity, for example, it's about 7% in suburban areas. So it's still high, relative to the number of people who live in those suburban towns. But it's about 2 or 3 times higher in the city centers. And you can see that, other questions on the survey besides food insecurity look at like use of food banks and other topics that show a similar pattern. This is a slide showing the trend over time. So from the 2015 survey to the 2021 survey, you can see food insecurity has declined. And I think other national surveys have found similar results this year. They postulate, there's evidence that decline in food insecurity, a lot of it is due to the number of families receiving assistance during the pandemic. So through the child tax credit, expanded unemployment, and many other supports that families received. You can actually see that in the Connecticut data. Oops, if you look at the orange line here, that represents food insecurity among families, so people with children in their household. And the light purple line near the bottom represents like single adults. And you can see generally like the food insecurity dropped more among families than among single adults in Connecticut. We generally, because of the Valley demographics are similar to the state in many ways, we would expect the trends in the Valley to be similar, but we won't be able to present that until early next year once we have the full data set from the entire state. We also found increases in underemployment during the pandemic. Many residents obviously lost employment in early 2020 due to the arrival of the pandemic. However, in 2021, rates have sort of come back down to where they were before the pandemic in terms of underemployment, which is, measuring residents who are unemployed looking for work, but also residents who are working part-time and preferring to work more hours. So that's something we ask about on the survey. Some of that could be driven by the fact that people are working fewer hours but don't want to add hours. You've seen sort of a decline in labor force participation, especially among women, wanting to not work or work fewer hours during the time of the pandemic. But yeah, that's basically the trend we saw in work. The survey also has many questions about well-being and health. And one thing that we found sort of striking was, if you break down the survey results by income level, so if you look at adults with limited income, most of them are saying that they're about the same financially or worse off financially during the pandemic, whereas adults with high incomes, about half say that they're actually better off financially during the pandemic. So it's that shows the pandemic has had a different impact on different parts of the region, different families. Many report they're doing better than they were before in terms of finances, and many are reporting the opposite. We see that especially by age. I think there's higher anxiety, less sort of life satisfaction and happiness among young adults during the pandemic, which could be related to a lot of stresses that young adults experienced. Overall, though, the pandemic, if you look beyond finances, the pandemic has had many impacts. As we know, about 17% of adults lost close friends or family members in Connecticut. And 24% say that they had COVID themselves, and among those, a significant share continue to have severe symptoms. So basically they're still experiencing the symptoms from that even like many months after having COVID. So, I sort of talked about the other topics on this slide. We also measured trust in institutions. So I think the health departments are, and hospitals are encouraged by this data that the level of trust in health systems is very high in Connecticut, especially compared to trust in like the federal or state government. So it does sort of speak to like, if you are planning to do something about improving health, well-being, or address the pandemic or other factors, it's important to work with local partners like health departments and not just rely on like the federal or the state initiatives to do everything. So you do need to build, local trust in institutions to sort of counter the fact that the levels of trust in those larger government agencies are not as high as they have been, in previous decades. The survey included questions about vaccination rates. So these rates are from August. The vaccination rate has since gone up a little bit, so just take this with a little bit of a grain of salt. Typically these rates would be a couple percentage points higher at this point in the year. But there are, large differences in the vaccination rate. Someone the other day asked us about young Latina women who are maybe single parent women. And we know that women who are pregnant or think they may become pregnant, they're planning to become pregnant, their vaccination rate is especially low in the United States. I think it's maybe around 30 or 40%. So there are groups within, if you look at the Latina rate, say it's already lower, 70% of adults, but if you sort of break it down further into young women, those rates are actually even lower than what this slide would suggest. So it's important to look at the intersection of race and gender and other issues like that. So there's, overall though, Connecticut had the highest vaccination rate in the United States at the point of when we created this slide. So rates are pretty high across, relative to the rest of the United States, they're pretty high across all groups. There are other factors that are more predictive of vaccination rates than just sort of demographics. The most important is political affiliation. So with Democrats being, if you adjust for other like demographic factors, Democratic residents who like are Democrats or they lean Democrat as independents, they're maybe 4 to 6 times more likely to be vaccinated than Republican residents. So there's concerns about different sources of information that different groups receive, and also other issues that relate to that would be trust in federal government and issues like that. Those are all things that could be addressed through smart policies as we seek to boost vaccination rates, both for COVID but also for other very concerning diseases like measles and the flu and other things that vaccine can prevent. So like I mentioned, trust in government, trust in healthcare systems are important in predicting vaccination. And just being financially comfortable is also important. If you look at people who are not insured, their vaccination rate is much lower. If you look at sort of residents who have trouble getting healthcare, don't have a doctor that they know, or don't sort of have a regular place of care, their vaccination rates are much lower than adults who have like a medical home or a doctor that they go to regularly. So, and that's even adjusting for age and other factors. So one thing that's interesting is if you look at that bottom bar, it talks about residents who find it difficult to get by financially. And you can see the light red is the adults who are not vaccinated who say that they'll get the vaccine as soon as they can. So it's not necessarily an issue of not wanting the vaccine at all, but many residents are just busy, especially young people with children and residents who are just struggling to get food and housing. The idea of getting a vaccine is not necessarily at the top of their list. So if we could do more to support families, with financial issues and other sort of burdens that they have and stresses that they have, you'd likely see that they'd be more likely to get vaccines, just because a lot of the reason for not getting it could be just stress among families that are financially stressed or otherwise stressed. Then this last slide just looks at mask wearing. So we asked people often wear masks, and the pink dots represent the rates in 2020. So in 2020, mask wearing was actually much higher than this year. People have sort of are not wearing them as much as they were last summer, which is understandable. A lot of the drops, though, are decreases are among men and among workers who are higher income, who are just more likely to be staying home still. So they're maybe wearing the mask less often, like going out to restaurants or grocery stores or places like that. But whereas the workers who are have limited incomes, they may still be working in jobs that require them to wear masks, like in retail settings. So I'm going to also just give you a quick update on the town equity reports. These are reports that we released for each of the towns in the state. And you can go and download the report for your town. The reports have more 2020 census data in them. Also, they look at various issues related to race, ethnicity, gender, and neighborhoods for each of the towns. So the reason we created these was there wasn't a good source of information at the town level where you could break down data by race, ethnicity, and other things. So we actually it took us, a long time, but we went through all of the federal databases and also the Wellbeing Survey and used the raw data to create those rates for each town in the state. So this creates a new data source that wasn't previously available for the state. And it covers many of the topics I just talked about, things like homeownership and housing, income levels, health issues, and civic participation. So this last slide shows one of the graphics from the Oxford Town Equity Report, which looks at the state as a whole in dark blue. Oxford is sort of the light green on this slide. And these are just some of the measures in the survey. So like whether residents trust neighbors, whether youth have positive role models. And you can see for Oxford, the rates are higher than they are for the state and the reference area around Oxford of similar towns for all of the data points. So that's an example of just the type of data you'll find in those reports. They're all each one's about 30 pages of data about, your town. So we've seen those be widely used by town officials and nonprofits that try to focus on one or two communities. And that's the end of the last slides I have today. I'm happy to take questions. Thanks.
So Mark, one of the comments in the question and answers when you were giving this presentation was about Shelton and the affordable housing piece, and that the point was raised that there is the belief that a percentage of the new housing in Shelton is going to be designated for affordable housing. But if there's anybody on the call that wants to weigh in on that can give us a little bit more of an answer, we'd be glad to hear that. So feel free to let us know and pop that in the Q&A so that we can do that. In the meantime, I think it would be really useful for people to understand and have an example of what those wealthy suburban, urban periphery and urban core towns look like here in the Valley, right? So people can kind of wrap their heads around, because the minute you hear urban core, at least when I hear urban core, I'm thinking of Waterbury, I'm thinking of New Haven, I'm thinking of Hartford. Do we have urban core here in the Valley? And can you give some examples of what those other ones look like?
Yeah, the the breakdown, by the 5 Connecticut's, it's just based on the population density and like the poverty and income levels of towns. So they sort of cluster into 5 groups when you do that. And it's more of a way of describing like how neighborhoods and towns differ across the state than it is a way to, put one town into like a specific category, though the towns are categorized. So in the case of the Valley, I believe like Ansonia and Derby are considered urban periphery towns. So they're sort of similar to the urban core in some ways, but maybe like less population density or slightly higher income. The urban core, though, if you took like a part of the town of Ansonia, for example, it would most likely fall into the urban core category. Because Ansonia has its denser sort of downtown and sort of more suburban parts of the town. And then the other categories are rural and wealthy and suburban. The wealthy towns are actually just, there are only a few wealthy towns. Those are towns where like there's just so much wealthier than other suburbs that they fall into that category. So those would be like Darien, New Canaan. Woodbridge actually falls into the, some people consider Woodbridge to be almost part of the valley. So that's one of the, I think that's the only wealthy town that's not in Fairfield County. And then suburbs, most of the towns fall into that group unless they're still rural. So, parts of Seymour, until recently at least, Seymour was considered a rural town because its density is lower than most towns.
Thank you. And we talked a little bit about the decreases in the food and financial security and that piece. And you said that across the country, that this is because of, certain programs that have been used to help people and provide assistance and other sources, right? Like philanthropy. For me, I have this question, does that data run the risk of giving a false impression of circumstances that are just temporary? Or is this something that, is going to become reversed? Or are you seeing that across the board? Can you comment on that, please?
Yeah, I mean, it's important to remember, like, even though the overall rates have come down, we still have large disparities despite that in the Valley. Not partly there's still need, but also like the access to those programs was not universal. Like not everyone could get those credits and incentives and things. So that's an important point. And then, like you said, the effect could be temporary. Like if the economy worsens again for some reason, or if those programs go away, like around subsidized health insurance or other things, you would expect to see the levels of stress and insecurity rise again if those programs are discontinued at some point. There is some evidence, like one thing that expired was the eviction moratorium. So in some places, for many months, evictions were very rare or very uncommon due to the moratorium. And when that expired, some areas have been seeing increases in eviction again. So certainly, like here and there in Connecticut, though, overall, I think the rates are still lower because of the other supports. And one of them, there's rental assistance is one example of a program that was created to help landlords cover that shortfall in rent with the tenant. Yeah.
And to that point, we, through the COVID-19 fund with our partners, the Valley Chamber and the Valley United Way and the Valley Council for Health and Human Services, also just supported Operation Fuel, which is providing fuel assistance, right, as part of that. And out of the COVID-19 fund, because it was clear that the reason why people were coming to request this, assistance was because of COVID, right? I mean, it was because they were impacted, whether they lost their job or whatever was the issue. So yes, and any other ways that we as the foundation or we as the Valley can begin to prepare for this, Mark, if it does start turning around and is reversing because of other swings. I mean, are you noticing that there are other areas that are kind of working on the preventive side, right, to make sure that they don't slide back into this again?
Yeah, I mean, it's important to understand what's happening in the community. So, and it's not just about, I mean, the financial security measure is really like, you could look at evictions, or in our survey, we ask people, how financially secure they are basically, and whether they can afford food and things like that. So that those are important measures, but there are other measures that are also important, like feelings of safety and support for social support is the question I know someone asked in the chat. That's like support from friends and family. So it could be support from if you're in school, like from your high school or middle school. So all those things are also important to track, because even if those trends can change, and also even if like families are more secure in terms of like paying their rent that month, it doesn't mean that they're still like feeling great about other aspects of life. So.
And to that point, one of the things that we're seeing, and I know this has always been a hard data point to capture in the past when we've been doing the index with you, is all of that behavioral health, right? Of having people report back out how they are doing. And I know that that is part of what you try and capture in the well-being survey of how they're feeling. When you're starting to look at that, have you started to see people are just, typically more anxious and concerned?
Yeah, so we saw that like mostly in younger adults. I think we don't know exactly why that is, but yeah, it is something we try to measure. There are other ways of thinking about it though, like in terms of access to resources like counseling and mental health providers. So from what we hear anecdotally, at least, it's like there's a long waiting lists and sort of shortages of care for the amount of demand that there is in certain areas. That's something that we would want to try to measure through data about, and try to understand the reasons for that. But I think that's probably a topic that will be a focus in the community index for 2022.
Absolutely. So here in the Valley, it comes as no surprise that there is a high level of trust for our local health officials on this particular topic. Earlier today, many of the people on our call attended the Valley Council for Health and Human Services annual meeting, where both the Naugatuck Valley Health District and BH Care were being honored for their contributions to health and well-being of the Valley during 2020 and this past year, 2021. Griffin has also been a leader, as you know, in COVID testing and vaccination support. The data that you provided about vaccinations, I know, has been shared with the state and other officials. Is it your sense that this data is impacting the current approaches to vaccination efforts? And we've been so pleased to have Connecticut be such a leader in vaccination rates, right? Is there the hope that we can still continue to improve on them, Mark?
I think there's the hope that we can. Many advocates like throughout the state were, right from the beginning of the pandemic, monitoring COVID data, and including in the Valley, and also then like when vaccines started to get rolled out too, that there was a lot of interest in finding out what was happening. So Connecticut actually did I think a better job than most areas at like publishing that information and making it available, partly just due to the request. So in looking at that data, we wrote a report in 2020 about COVID-19 and social inequality that, where you could really tie it to like things like overcrowded housing and other issues. So that data, and advocacy supported efforts to like give Connecticut very strong eviction relief and housing, assistance. If you compare Connecticut to other states, I think quite a bit more was done than like the typical state in those areas. So I think the data can really drive action in that sense. With vaccination, it's a little harder to see. I know the state made an effort at making vaccines available like through workplaces and schools, and but I think the data we're collecting on vaccination is like a little bit retrospective, because our survey began when vaccinations started. So we did ask about it in 2020, and basically you could predict what the vaccination rates would be before the vaccine was even distributed, if you understood how much people trust their healthcare providers, do they have access to healthcare, and those things. So, I think that was known, and there was an effort to mobilize resources around having like local clinics and sort of that sort of thing. But if you look at the data, you can see like more could have been done to, specifically reach out to the communities that are still lagging behind. And that's true not just of COVID, but with influenza, other types of healthcare. I think it's a similar story.
And to that point, I'm sure you probably don't have any data on this yet, but I'm sure in a similar vein, you can predict who's going to be getting the booster shots as well, right? I mean, it's same kind of concept.
So that one I'm not as sure of. Like I haven't. That's so new. I haven't really explored that data. Like why are booster rates so high in some places, and that booster shot's only really been, people have only been like encouraged to get it for a few weeks now. So
right,
something, we may
jury's still out.
Yeah, and if they do like another booster with with the variant that's out, in next year or something, that's something to look at. But the good hope, where everyone's sort of hopeful that booster or not, like the vaccines will be protective of severe disease. I'm hoping that's the case for sure. So even if a lot of people are like focused on boosters now, but there still needs to be a focus on just getting people their first dose or their second dose as well.
I know we only have a few minutes left, and I just want to encourage people to drop any questions that they have in the question and answer. In the remaining time, I'd really like to turn our attention to the town equity reports. Mark, what are you hoping are going to come out of them? How do you hope that the towns will use them? Because again, we have several folks that are representing communities throughout the valley here, and we want to know how to use them most effectively, either individually or on a regional basis.
Yeah, so those were developed like I said, sort of in response to requests for data about towns. And often we can, if people have questions about their town, like they'll email us, often we can sort of find the answer. It's on the Census website or somewhere else. But a lot of questions we were getting, especially starting in 2020, like couldn't be answered through the data. So those were questions about like how different segments of towns were doing by race and ethnicity. And the fact is, like there just wasn't data on those topics. Like it wasn't published, or it was not available anywhere. So the town reports are designed to like make that information available, not just for the towns, but for groups in the town, like by race, ethnicity, and age. And we'd like to add other breakdowns too, just as we go along. We think those would be useful for like a number of reasons. Like I think there's research on like perceptions of the health of towns, for example, and people may be aware of like health disparities and differences in health across their town, but they may not know like how wide the disparity is in a lot of cases. They just may have a sense that it's there. So having the actual numbers can help advance those conversations and give people like a number to start working with. The other thing people don't always recognize is they may think there's differences in their area, but it may not apply to their town. So they may think like, Connecticut's a place with a lot of inequality, but it's really because of like Hartford versus Greenwich or something. And the town reports show that the same differences you can see across virtually any, even the wealthiest town, you still see the same socioeconomic and health disparities. So again, that data wasn't really available in many cases or easy to get. So we wanted to sort of like put it all in one place for each town. And I think many towns have created like commissions to look at equity in their town to make their town a better place to live for all. Like there's various commissions and resident committees in each town, and also in some cases like elected officials are focused on that too. So those are sort of what we envision to be the main users of the report. Those sort of like hopefully residents. It's designed to be easy to interpret, easy to read version of compared to like some of the more detailed reports that we publish.
And to that end, because I think that one of the things that we have always tried to strive for with the index is to make it user-friendly, right? And to make sure that people, our report didn't sit on the shelf and people felt very comfortable in getting to it. I think that for me, the equity reports are exactly that. They provide some really useful high-level data in one spot that speak to, you know, those differences that you're talking about. And you know, it's interesting that when you're looking at some of that data, you can say, wow, you know, there really isn't a lot of differences between all of the communities here in the Valley. There are individual, perhaps neighborhood level differences, but not, you know, across the board, that they are so much of a big gap. And I'm sure that you have found that in other areas across the state. Is that correct?
Yeah, I think generally speaking that's true. There are like important nuances. Like the town equity reports are like, you think of them as a starting place for discussion. Like it is nice to have hard numbers and be able to start a discussion that way, but you often have to then like take it another step and think about, you know, the different groups in the town and some specific issues that affect each town. So that's where we see like more differences by town. So like Torrington, for example, like the Latino population in Torrington would be very different from the Latino population in like Stamford or Hartford. So it's important to have that, you know, these are more of a starting place, and then having the local knowledge, not just about the disparities, but like you always have to think like the reasons for it. There's some text in the town equity reports that talks about, you know, some of the causes and reasons for health disparities and things, but that's the next, you know, question to think about, like how do we you know, make the town a better place for everyone and sort of reduce those barriers.
And for us, because it's the Valley, we take that a step further, and we're looking at making the Valley a better place for everybody. So I see that we are nearing the end of our time, and I know Sharon has a couple of things that she wants to conclude with. So Mark and Coral, I just want to thank you so much, both of you, for sharing all of this really important information with us tonight. It's clear that by evaluating the trends that you have found in the data, both of the town equity level data and all throughout the wellness, that we can better understand where the Valley is making progress and where there are opportunities for improvement. We look forward to continuing to analyze this information and working with you to include it in the 2022 Valley Community Index, which is going to be released, as Sharon said, later next year.
Thank you.
So thank you again. And I'd like to turn the program now over to Sharon for a few closing remarks. Sharon?
Well, thank you, Val. And really thank all of you for a great presentation and for breaking down this comprehensive information in such an understandable way. There's so much data out there, and we know how important it is. And we look forward to keeping everyone updated about key data points that are affecting our Valley and continuing to engage in meaningful dialogues to foster a more equitable and inclusive Valley for all. Please complete the evaluation survey, which can be found as you sign off of tonight's presentation. And again, thank you all for attending. And for everyone here at VCF and DataHaven, we wish you a safe, healthy, blessed, and joyful holiday season. Have a great evening, everybody.